Now. All right, you're all welcome to today's speaking class. I'm Tunde Thompson, the instructor of the T-Square OET Academy. And as you are just joining, I think the doctors were the first to join. We are going to start from the doctors now. So Ose, please, can you unmute your mic?
Okay, I'm here.
All right, that's fine. Ose's mic is on. Now, can you see the task on the screen?
Yes, I can see it.
Now, the task on the screen, you have two tasks on the screen. One is for the role play card, and the other one is for the doctor, and the other one is for the interlocutor. So the one in black, yeah, the one in black is the one you'll be looking at. The one in blue, I'll be looking at that, okay? Because on the exam day, you will be given your task. You cannot see the interlocutor's task, yeah?
Okay.
Yeah. So you cannot see the interlocutor's task. Let me just move this one away from, yeah. So now I hope everybody can see the task on the screen. So I'm going to give you 2 minutes, Ose, to go through your own task. Then I will now ask you to start. Is that all right?
That's fine.
All right, it's 17:35. Your 2 minutes starts now.
Okay.
All right, your time starts now.
Okay. Good afternoon. I'm Dr. Osei. I'm one of the training doctors in this GP practice. Please, can you confirm your name and your age for me, please?
I'm Thompson. I'm 45.
Okay, what actually brings you to this practice today? What are your concerns and your expectations today?
Well, to be honest with you, doctor, I've been having this, although I've been hypertensive and diabetes, yes, which I've been treating, but of recent, I started experiencing this chest pain, and I'm kind of worried that I may die because my father had similar experience.
Oh, your concerns are very valid. I want to assure you that. I thank you for telling me about your complaints, and I assure you that nothing will happen to you. And I would love to ask you some follow-up questions. Is that fine?
Yeah, that's fine.
Okay. When did this chest pain start?
Well, just for this morning, I just woke up and I didn't feel anything quite well. But as I started driving, I started noticing this sudden sharp pain.
Oh, did you notice any feeling, maybe not being nauseous or trying to retch, or did you vomit at any time?
No, I never feel nauseous, neither did I vomit, but I can feel the pain was kind of radiating to my shoulder tips and bleeds.
Oh, okay. Your concerns are very valid, please. I can assure you that with these symptoms you said you are hypertensive and diabetes, it's going, and this sharp pain that is radiating. I think you are having what they call a myocardial infarction. Have you heard of anything like that?
Myocardial infarction? Do you mean,
Yeah.
Is it the same thing like heart attack? Because my father had one.
Oh, thank you. I think you have a good understanding of what it might mean. But myocardial infarction is when the blood supply to that part of the heart has been shut off. And this can actually cause you to have symptoms like that. And this can actually result in a heart attack. But I can assure you that right now you are not having a heart attack itself. But I will actually recommend you that you actually be transferred to a hospital for appropriate treatment. Is that fine?
Well, to be honest, I don't like hospitals. I want to be treated in the GP practice.
I can understand your concerns, and I understand the stress this will actually cause you. But I can assure you there are a team of multidisciplinary doctors here who are actually going to take care of you. And I can assure you that we want to pick up anything sinister because it's better picked up very early. We do not want maybe what happened to your father to happen to you. And I'm actually really very sorry about the death of your father, as it were. So we really love you to come to the hospital. Is that fine?
Okay, if you think that's the best thing to do, I think I have no other option now.
Okay. Yes, when you come to the hospital, you will actually be referred to a specialist for the heart, a cardiologist itself. He's part of our multidisciplinary doctors itself. He's going to assess you. And what we actually do is that she's going to either initiate appropriate treatment for you, as this is just a GP practice. Is that fine?
Okay, that's fine.
Okay, I know you came earlier and you presented with these symptoms, and I've just tried to elucidate and ask as many symptoms as you may, as you presented, trying to link it with, the myocardial infarction. And I try to explain, what myocardial infarction is. I made mention of how my blood supply has been cut off and stuff. And I would really like to give you some patient information leaflets, because I know I've said a lot today, and also a call tone number, a 24-hour call tone number you can actually call. Is that fine?
Okay, it makes sense.
I can assure you you'll be fine, and please do not worry. Did you have any other question?
No.
Okay, thank you very much for presenting. The nursing assistant will give you your further appointment and the time to come. Thank you very much.
All right, thank you very much. Your time is time now. Just finish at the exact time. Well done, Ose. Well done. But before I make my comments, I want to hear from the class. What do you think about this presentation? Okay, they're already clapping for you. Some of them somebody is already routing for you. Madid is already clapping for you. All right, if you have anything to say regarding this speaking, you can raise your hand. I will give you the time to say that. All right, nobody wants to say anything. That's fine. Well,
okay. My name is Nurse Juliet.
Okay, Juliet.
No, Dr. Ose, you tried. Thank you so much for the nice presentation.
Thank you.
You tackled every questions that I was supposed to tackle. The last part where you said the nursing assistant will give you further. But how did you put it? You said the nursing assistant will give you further. Is it follow-up?
No, your follow-up appointment visits. The maybe a paper or something. Yeah.
Well, it's not the nursing assistant's duty.
Oh,
is it the duty of the nursing assistant?
Let me come in there. Well, whatever you say, whether you have the knowledge or not, they are not scoring your knowledge. Even if you tell this patient that for you to be treated for this myocardial infarction, you are going to take a poison and you will die. Let me go to the next week. Let me say you are going to take a poison, and this poison will help to treat your this illness or whatever. They are not marking you for your medical knowledge. Yeah, so don't bother yourself so much about whether it's the right person to do it or not. It's the English they're actually looking at.
Okay, thank you.
Thank you.
Yeah.
That's all said. Thank you.
Thank you very much too for the.
Any other comments? All right, Ose, I think basically you did well in this presentation, because if this were to be the re-exam, you pass and you also pass, not just pass, you also pass very well, because you were very fluent, which is the major factor here. You were very fluent and there were no hesitations at all that I could, we hesitate normally when we talk, but when the hesitations becomes very obvious, that's when we are concerned about it. In your own case, there wasn't any obvious hesitation at all. And I think overall, you did a very wonderful presentation. But let's start from the introduction. The way you came into the presentation was really nice. You tried to establish rapport with the patient, try to introduce yourself, and also try to know the patient's name and age, which I think it's a nice one that you did there. But in terms of the relationship building, you could not sustain it throughout the conversation. Once in a while, as you're talking, just try to still call the patient his or her name. I told you my name is Thompson. Once in a while, you can mention Thompson. I
Yeah,
can
I
see that you're
forgot the
very.
name.
You understand? So it's kind of help to build your relationship, kind of help to build the relationship with this patient, because that's still part of what you are being assessed on. And then there was a part when you use medical jargon. Yeah, when telling the patient what medical condition patient has, it's good to mention the medical condition the way it's mentioned before you explain to the patient. When you said myocardial infarction, yeah, although the patient tried to say, okay, is it heart attack? Myocardial infarction is the same thing as heart attack, although you give a very, very compelling and convincing explanation. That's also very nice. But the myocardial infarction, the layman term is just heart attack. Okay, but just as I've said before, the knowledge is not what they are scoring, rather it's your presentation. Now, you did very well, but at the later part, I didn't like, although some persons will say when you are done, try to summarize. Well, I'm not a fan of that summarizing. There are a lot of things that you could do, of which you still did part of it, trying to like schedule a follow-up for this patient. Another thing you can also do is to give this patient a warning sign. Because by the time you now start, just take a look at it. You've finished talking with a patient in a GP practice or in your clinic where you're working currently. On a normal day, you don't start all over to start revising or reviewing in details what you've said and what you guys have discussed over and over. Even if you want to do that, is the salient points, the most important gist there that you can bring, maybe to re-emphasize on that. Maybe you've told the patient how to take a particular prescription, which is very important. You may try to like re-emphasize on that point, and not summarizing what you've said is not you starting from the beginning. You came in, I greeted you, you greeted me back, I said this, you said that. No, that's not how to summarize. So for me, I would just say you should just avoid it. The other part of the ending part, the other part you brought in was even more real than you trying to summarize. Yeah, trying to schedule appointment, telling that the nurse will try and sort you out, and all those ones were more conversational, more interactive than trying to summarize everything. Yeah.
Sure. Yeah,
because even at that point, you were even saying a lot of, you are now talking, it made you to talk for a very long time. And now you are bringing in a lot of information. A patient cannot swallow many information at the same time. Yeah. So it's you give a patient one information at a time. By the time you start loading the patient with a lot of information, it kind of affects your conversation. So it will even impede on the relationship building with that patient, because he might even get lost and might not even follow through what you're even saying anymore. But overall, this is a very nice presentation. It's a very nice one. Please keep it up.
Thank you very much. I appreciate it.
Yeah. All right, that's fine. So we've taken one doctor. So what we do, take a doctor and then a nurse. So the first nurse I have here is Helen. Helen, are you still in the class? All right, please start.
Okay. Hello, Mr. Paul. Good morning.
Hello.
My name is Helen. I am one of the registered nurses in this nursing home, so I'll be attending to you.
That's fine.
So, Mr. Paul, what really happened?
Well, to be honest with you, I really don't know what is going on with me, because I kind of felt drowsy this morning, and I landed my head. I kind of hit my head on the floor. So as it stands now, I'm kind of confused. Do you really know what is going on with me?
Oh, I'm so sorry about that. I can really understand how you feel. So you don't really need to worry. We'll do some investigation for you. Would that be okay by you?
Okay. When you mean investigation, what's really going on?
Okay, you complain about dizziness and you want to find out what really happened to you. So with that investigation, such as brain CT scan, from there we'll really know what is happening to you, what really happened, what caused this dizziness. Is that fine?
Okay, that's fine. But do you think what is happening to me is life-threatening?
We can't really say, but due to your complaint, with the investigation, it will tell. Is that fine?
Okay.
And also, due to the possibility of bleeding into the brain, and you need urgent hospital referral so that they can admit you.
Oh, no, 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 no. To be honest, nurse, I'm not really happy getting admitted to the hospital. I don't want to leave my cats behind. My cat will suffer.
Okay, I understand how you really feel about that, but you don't need to worry about it, okay? I will make an arrangement with an animal service to take care of your pets. Would that be fine?
Okay, that's fine. But how long do you think I may stay in the hospital?
I don't really know about that. The doctor will decide that. But the most important thing is for you to get to the hospital, they admit you, and you'll be fine. That's my most worry about.
It's okay.
Do you have any other concern that you need to discuss?
No.
Okay, so if you have, since you don't have further questions for you to discuss with me, so I will allow you for you to rest, then prepare your referral notes so that you can go to where you can do your CT scan. Is that fine?
Okay, that's fine. Makes a lot of sense.
Okay, so you just need to relax while I do other things. But meanwhile, I would like to give you a leaflet for you to read to know more about this CT scan, the brain CT scan that we're about to perform for you. Would that be okay by you?
Yeah, sounds quite fine.
Okay, so I'll go and get that. Just relax, I'm coming, okay?
All right.
Have I done?
It's okay. It's okay. You see now, you kind of rushed your presentation, right? And there are some parts you did not do well, like information gathering. You didn't gather information. Always know that in this task, they mark your information gathering, they mark your information giving. Yeah. In terms of giving information, you tried in giving information, but in terms of gathering information, you did not even gather information at all. Yeah, you could have explored this, ask more about these symptoms. How did it happen? All those type of ask 1 or 2 questions before you progress. So by so doing, you would have gathered information, check that box. Yeah. But before I make my general comments, let me hear from the group. If you have anything to contribute, you can go ahead and do that.
Okay, I have something to say. I think she did well. She did well, at least, as you've already said everything. But I don't know whether I didn't get, maybe she didn't maybe deliberately didn't get the name and age of the patient, of the I don't think, I'm not sure she asked.
Well, he
that.
gave me a name. She gave me
Okay.
a name, but she didn't confirm my age anyway.
Okay, your age. Okay.
Yeah.
Okay. Thank you.
All right. Any other contributions?
Oh, okay. Dr. Thompson, since this patient is a known patient, does she need to confirm the age again? Because it's a nursing home.
It's not really like a must to do. At least the name, that name is okay. Do you understand? It's not a must to confirm the person's age. Yeah. But even if she does that, that's also fine. If she also does that, that's also fine. Yeah, it's a nursing home. I agree. What about if she's a new nurse in that nursing home? You may want to confirm the person's name, yeah, person's age. So whether she confirms it or not, it doesn't really change anything.
Okay, so why I really didn't confirm the age is because it's a no patient. So I didn't know the patient. That's why I didn't bother confirming the age.
It's okay, that's fine. Yeah, but I think your major drawback is the fact that you didn't really gather information from this patient. Other aspects you tried, and then the way you express your empathy, so to say, it's like you just have only one phrase. I understand how you really feel. I understand how you really feel. Do you get? There are some things you might not even understand. That's not the only way that's not the only thing to say. Like in this case that I'm talking about, I don't really know what is happening to me and all. I don't even think it's even right to say you understand how the patient feels, because even the patient himself does not even understand how he feels. Yeah. So in that case, you can say something like this. I can see that you are really worried about what is going on with you. That's a way to express empathy. Yeah, I can see that you are quite distressed regarding this event that happened this morning. Yeah, I can't imagine how difficult this must have been for you. Yeah, I can see that you've been passing through a lot. Yeah, you sound a little bit confused. I can't imagine what might have transpired. So it's not just like a one phrase thing. Just let it be to rhyme with what the patient just said. You can even reflect back. The empathy word you're going to use, you can reflect it back to the patient. The patient might come like this and say, no, to be honest, I'm really angry just now. I really don't know what is going on. From what the patient said, you can reflect it back and use it as empathy. Oh, Mr. Paul, I can see that you are quite angry. That's understandable. Do you get, before you say what you want to say? So it's not like you must, it's one expression you have to be using over and over, just like you did. Yeah?
Lois!
Oh,
Okay.
who is there? All right, that's fine. But yeah, but overall, I think it's a nice try. That's okay. So let's take the next person before we go to the doctor's side. Kivilishim. I don't know if I pronounced that well. Are you still in the house? Okay. Muslim, can you unmute your mic, please?
Yes, I can hear, but I missed where is your lesson now. So I prefer to listening now.
Okay, that's fine. That's good.
Thank you.
It's okay. Yeah. So let's take Dent then. Dent.
Yes, I'm here.
Okay. Well, I think what you are going to do now, because we have less than 6 minutes, which should not be enough, I will end this session, create another Zoom meeting. Everybody will rejoin back, okay? When we come back, we will continue from where we stopped. And that will be the last session I will have anyway.
Okay.
All right, please start.
Okay. Good evening, Mr. Jones.
Good evening.
How are you today?
Well, I really don't know what is going on with me. I've been wearing this catheter for quite some time now, and it has started leaking. It's kind of embarrassing, you know.
Yeah, I can understand that, Mr. Jones. Okay, by the way, Nurse Dent. I'm one of the community nurses working here at the center. Okay, I can understand your concern, and I can really understand how you feel about this. Okay, but notwithstanding, may I know? May I really know when this started?
Well, I've been wearing this for quite some time now, but yesterday I've noticed that it started dripping, but this morning it has become something else. And I've made attempts severally to see if it will stop by adjusting the catheter, but still it's kind of draining now, to say. So it's really smelling and embarrassing.
Oh, sorry about that, Mr. Jones. I can really understand your situation and how difficult it is for you to really cope with this, okay?
But if I may ask, Nurse, don't you think that we need to change this as quickly as possible? Because I'm not really getting this, it's not really funny anymore. And I would also maybe request a bladder scan done, because I'm scared that something sinister might be going on.
Okay, your concerns are reasonable and your thoughts are also thoughtful. Okay, what I really want to explain to you, the reasons behind your leaking catheter may really be as a result of blockage or debris, or there may be tear or dislodge. That may really, one of them may be the really reason for the leakage. Okay, but for the scan that you are requesting, yes, even though there won't be need for that as such, okay, what we really need to do now is to find out or check what may be the reason for that, of urine urine test, blood culture, to rule out if there is any infection that may really be as a result. Okay, are you okay with that?
Oh, well, that sounds quite reasonable and makes a lot of sense. But if I may ask, don't you think I need to be urgently admitted? Because, you know, whenever I have this type of symptoms, I really become, it's kind of tilts me to sepsis, and it's quite devastating if it happens. And I don't really want that to happen. Can I be admitted in the hospital, please?
Yes, Mr. Jones, I can really understand how you feel about that. Okay, but I want to reassure you there won't be need for admission. What may really be done now is then but from there we can take the sample and you can wait for the result to be out. Pending that, we'll give you a drug name nitrofurantoin for just 3 days to await the result. Okay, is that okay by you?
You feel so that this doesn't require admission, just antibiotics?
Yes, that will be okay, Mr. Jones. Okay, I
All
told
right.
you earlier that we are going to change that for you. Are you okay with that?
Okay, it's okay then.
Okay, then let me go ahead with preparing for the change of looking for your test. Okay,
Okay.
do you have any concern?
No, not at all.
Okay, Mr. Jones. Thank you for the time and thank you for sharing your concerns. Really see how difficult it is for you to take care of yourself with this catheter. But I want to reassure you that pending when the result will be okay, while we change the catheter, you won't experience this again. Okay, so just
Okay.
calm down.
Okay.
Thank you.
All right. Your time is up. Okay, that's fine then. Any comments from the house? Because I think, well, let me allow you guys to talk, but let me not bias your comments, because I think she really did very well. Any comments?
Good evening, Dr. Thompson and the house.
Good evening. Yeah, a
So
lot of
sorry.
people are championing for you. Okay, everybody's saying you did well, then. Fedile said perfect, thanks, that's fine. All right, go on, please.
Okay, I wanted to say that I would have loved to comment on the past two presenters too, that they did very well. But the area where I wanted to come in is the area I noticed in one of your tutorials. You mentioned that you need to emphasize from the patient, asking them, is there anything still bothering them, so that in the way, so that they can say more if they still have more things. So I noticed that in the last speaker, she was able to probe into the patient to know if there's still more things bothering her. I think she did very well, and with others too.
Okay.
Thank you.
Yeah, thank you very much, Fumilola. That's really very nice. So it's very important that you probe your patient, yeah? But sometimes, like what I'm doing, the roll and play, I don't even give them time to even do that anyway. At which you also have something like that in the exam. They might not even give you time. They will just interject and you might not have time to say, okay, do you have any other concerns? Is there any other thing still bothering you? And I really like the last speaker. I think she's naturally, her tone is naturally nice, even without even her expressing empathy. Her tone is already empathetic. Is already expressing that she takes it softly and all that. So that's really, yeah, that's really nice. So I think overall you did very well. If this were to be exam, you've already passed, to be honest. Yeah. So we'll take the last speaker now, which this is the last I can take for today. That's for the medicine side. We are going to take Julius. We're taking somebody from Saudi Arabia. We're taking a doctor from Nigeria now. Julius. Is Julius still in the house? Okay, Julius is gone. Is there another doctor in the house that I want to present?
Yes,
I'm
Dr.
here.
Juliet.
I'm here, Dr. Badino.
I was the second person that came in. Juliet, not Julius.
Oh, sorry, I didn't write it where I was. Julius. Are you a doctor or a nurse?
I'm a doctor.
Okay, that's fine. It's okay because I have another Juliet here as nurse, but I don't think we'll take another person up at the end of this. So let's give you the opportunity to present and see how you perform. That's fine. So can you see this task on the screen?
Yeah.
You have 2 minutes to go through this and I'll ask you to start, yeah? So now is 18:16. By 18:18, I'll ask you to start, okay? Although in the exam, you'll be given 3 minutes. All right, your time starts now. All right, Juliet, please start.
Hello.
Hello.
You're welcome to this surgical outpatient department. I am Dr. Juliet. I'm one of the doctors in this department. I'll be attending to you today. Please, what may I call you?
You can call me Anderson.
Anderson.
Yeah.
Anderson, please, can I confirm your age?
I'm 65.
Okay. You're welcome to the surgical outpatient department.
Thank you.
I have your case note here with me, but I would like you to, in your own words, tell me the reason why you came to see me today.
Well, doctor, to be honest with me, I think at this point, I need a hip replacement. I've been going quite through a lot for the past 10 years.
Wow. Oh. So why would you need a hip replacement?
Yeah, I was diagnosed with osteoarthritis 10 years ago, and I was placed on some medications which have actually been helping all this while. But for the past couple of days, it's like as if the pain has increased, and this morning it has become unbearable. So I think the medications are no longer working, and I feel at this point I will benefit from a hip replacement.
Oh, Mr. Anderson, I truly apologize for the inconvenience this might have caused you and the pain that you've been going through for some time now. But don't worry, as you have come to see me today in the clinic, I hope I can provide some solutions to your problem.
That's fine. That's why I'm here.
Okay. The pain that you're experiencing, when is it normally worse? At what time of the day do you think the pain is worse?
Well, I said it's worsened since this morning, and it has not waned down since then.
Okay. Well, I know you understand what a hip replacement surgery is, as you have come to seek that today. But I'm so sorry that The hip replacement that you seek cannot be possible now. The surgery we have to wait till 6 months because we have a COVID policy. Anyone that is coming for surgery or one surgery, we give a window period of 6 months to be able to screen the patient properly because of the COVID. Do you understand all I've said, Mr. Addison?
This is unacceptable, doctor. This is really unacceptable. Is that what you guys do in the hospital here? Upon the taxes that I pay, you're telling me 6 months? Don't you think that 6 months is enough time for one to get paralyzed if nothing is done? Don't you think so, doctor?
Oh, Mr. Addison, I see that you are quite upset. And I know this will be very frustrating for you just because you are having this constant pain. We are so sorry. I'm so sorry that this is coming now. We can't really grant you the surgery. But there are other things that we can do to ease your pain. We can give you painkillers, some medications that will ease your pain. You can go about doing your work. I can even recommend physiotherapy for you. This will help you to be able to move your joints because the painkillers I will give you and the physiotherapy will help in reducing inflammation on that joint. And you're able to move again with it. This, with other follow-ups that I will also suggest to you, can abate the pain for the next 6 months before you do your surgery. Please, Mr. Addison, I know this will be quite discomforting, but we hope to give you the best. Do you understand, Mr. Addison?
Well, I do, but my concern and worry is this. What if with all this, the pain, the symptoms progressively worsened? What now happened?
Well, Mr. Addison, there is nothing to be overwhelmingly concerned about. I can assure you that the medications that will give to you will be just appropriate for this condition, and your pain will be eased.
All right, your time is up. Your time is up. All right, Juliet, I think you really did very well, though. You did very well. Your introduction was very perfect. You introduced the setting, you introduced yourself. Your introduction was perfect. That's how an introduction should be, really. You did a very fantastic job in that aspect. And your information gathering, good, although you kind of trying to overflow things there anyway, but you were able to gather enough information at that initial point. Your information giving also very great, yeah, but don't be too slow or too sluggish in.
Yes, I noticed that too.
Yeah, so don't be too slow anyway, trying to preach like a pastor. But overall, to be honest, you did a very fantastic job. There is something I want to correct. When a patient becomes angry, because your voice was really very sweet, very, very nice and all, following with the patient. But when the patient now became very angry, raising his voice, you kind of raised your voice when trying to
calm.
Yes, your voice is supposed to come down, not even, you're supposed to go lower the way it used to be before. But at this point, you raised your voice with the patient too. But aside that, you did a very fantastic job. This is really very nice, to be honest. I'm really impressed with your presentation. Yeah. Yeah, everybody cheering for you. Great job, great job. That's very nice. So how I wish I could continue with the whole thing, but to be honest, I can't at this point, although I have another class, but that's for my paid class by 7 o'clock. So I have to rest before that class, really. And any other time I have, in the future, if I still have time, I will always organize free classes. But if you still want to join my paid classes, that's also fine. But I believe my free classes and all the tutorials I have on YouTube is more than enough for you to pass. But if you want to join my paid class and you can afford it, that's also fine. So at this point, we are going to call it a night. And those of you that could not present, so sorry, we cannot take everybody, okay? All right, I wish you guys the best. For those of you writing exam, coming very shortly.
Please, how much is your paid class?
Yeah, you can check this thing on my the Telegram group. Is on the pinned message there so that you get the details there, okay? All right, do have a great night. Bye-bye. This class is recorded. I'm going to upload it on my YouTube channel in case you want to listen to it again or listen to yourself and see how you've performed. All right, do have a great night, guys. Bye-bye.